Welcome to HITshow, your go-to source for today's leading healthcare business headlines. I'm your host, RHONDA Brooks. It's Wednesday, September 10th. Today on HITshow, new limits on pharma advertising spark controversy, fresh scrutiny on the 340B drug discount program, and food as medicine partnerships take center stage with Medicaid and senior care populations. Plus, an exclusive interview with Harshit Jain, CEO of Doceree, on the launch of Reptwin. Let's dive in. We start with a policy move shaking up pharma marketing. Anika Shah has the story.
President Trump has directed the FDA to limit direct-to-consumer drug advertising. The order cites concerns over misleading claims and rising costs. Drug makers and advertising groups are expected to mount strong legal challenges, arguing the restrictions infringe on free speech and consumer access to information.
Anika, what's at stake if this move sticks?
Billions in pharma ad spending, RHONDA. The US is one of only 2 countries that allows direct-to-consumer advertising, so any change here could reshape global marketing strategies.
Thanks, Anika. Now to a congressional report with big implications for hospitals. Logan Stokes has the details.
The Congressional Budget Office released findings that the 340B drug discount program incentivizes hospital clinic consolidation and may actually increase overall healthcare spending. While the program helps safety net providers access discounted drugs, policymakers are questioning whether its current design is driving unintended consequences.
Logan, what might we see next?
Expect hearings and bipartisan proposals to reform 340B, though hospitals are gearing up for a fight to preserve funding streams.
Thank you, Logan. Time for a quick break. We'll be right back with food as medicine partnerships making headlines.
HITshow is made possible by Altera Digital Health's Sunrise EHR, the flexible solution that provides tools and technology clinicians need to deliver better care their way. And with AI integration, Altera is leading with heart, bringing the human side of healthcare even closer.
Welcome back. Teresa Vaughn has the story on a new food as medicine collaboration.
Pear Suite, a platform supporting community health workers, is teaming up with Instacart Health to improve food access for Medicaid members nationwide. The partnership integrates Pear Suite's social care tools with Instacart's grocery delivery, aiming to close nutrition gaps for vulnerable populations. Advocates say it's another sign of food being treated as a critical part of healthcare.
Teresa, how soon could patients see the impact?
Pilots are already rolling out in several states, with broader expansion expected in 2026.
Thanks, Teresa. Nate Collier has more on another food as medicine partnership.
Epicured and Fallon Health are expanding medically tailored meals into programs of all-inclusive care for the elderly, or PACE. The model combines dietitian-designed meals with coordinated clinical support, helping frail seniors avoid hospitalizations and stay independent longer. Fallon Health says it's the first time food as medicine has been fully integrated into PACE programs.
Nate, what makes this partnership different?
It's the tight integration, RHONDA. Meals aren't just delivered, they're tied directly to care plans and tracked alongside clinical outcomes.
Thank you, Nate. To close today's show, Jalen Cross sat down with Harshit Jain, CEO of Doceree, to discuss their new AI-powered innovation, Reptwin.
Thanks, Rhonda. 65% of physicians now restrict sales rep access, and FaceTime averages just a few minutes. I talked with Harshit Jain from Doceree about Reptwin, their AI-powered solution launching at Fierce Pharma Week. Harshit, you're saying the pharma sales model needs an upgrade.
It is a model that pharmaceutical brands started probably 50 years or maybe more ago, but the model hasn't changed much. The sales and marketing efforts for all other categories across the world have been influenced by digital and now so much by the AI, right, which is the talk of the town. So I think the pharmaceutical sales and marketing model also needs an evolution or an upgrade to keep up with the times.
How does Reptwin work inside physician workflows?
So we want to bring that intelligence as Doceree. We want to bring that intelligence in the world of sales rep as well. That's why introducing a novel idea, calling it a Reptwin, where It is a virtual sales rep which is placed inside the ad unit that a brand runs in the digital space. So now a physician, imagine he's seeing a pregnant patient with diabetes, right? And he has his electronic health record open in front of him. And he just made the diagnosis and he has a question, can I prescribe this drug to pregnant patients? So he can just click on the action button, which is the rep button, and the rep will come up on the screen.
What makes this different from just another chatbot?
Now, this virtual rep, right, is powered by AI, and this rep knows everything about the physician. So the conversations are hyper personalized and very much contextual and to the point. So now a physician would have access to rep any time of the day, whenever the physician needs it.
With integrations across 2,000 medical publishers and 150 EHRs, including Epic and Cerner, Reptwin puts HIPAA-compliant virtual reps exactly where physicians make clinical decisions. You can find out more at HIT.show.
That was Harshit Jain, CEO of Doceree, on how AI is changing pharma engagement with healthcare professionals. That's all the time we have for today. Thank you for joining us on HITshow. If you liked these stories, please follow us on LinkedIn and check out our in-depth feature videos on HIT.show. HITshow, your go-to source for healthcare business news, can be found all the places where podcasts are heard. Please join us again tomorrow for the latest headlines in healthcare. HITshow is made possible by Kimchi. Transform your team with an agentic AI workforce that creates, optimizes, and distributes marketing content while keeping the human touch. For an AI workforce powered by you, Kimchi.com.